Greetings from Washington, D.C. This is Peter Thomas, the General Counsel for NAAOP. Before I get started with this month's message, which focuses on the one limb per life restriction in New York State, I wanted to touch base about the requests that NAAOP made last month. They include your efforts to contact your congressman to try to get them to sign on to two different sign-on letters. One addressed to Secretary Burwell of the Department of Health and Human Services, the other addressed to Secretary McDonald of the Veterans Administration, both involving orthotics and prosthetics. The first letter, still open for signatures from your congressman and senator, is the Costello Duckworth letter. If you go onto the NAAOP website at www.naaop.org, you'll see this letter in the Legislative Action Center, and there's explicit directions as to how to contact your member of Congress and urge them strongly to sign on to this letter to Secretary Burwell. The letter does two things. It pleads with HHS, the Department of Health and Human Services, to finally regulate BIPA 427, which is a provision that was passed in law 15 years ago and yet never regulated. That provision would link the qualifications of orthotists and prosthetists with the ability to be paid by the Medicare program. The letter also urges the Secretary to amend the current regulatory definition of off-the-shelf orthotics, which Congress clearly intended to apply to devices that needed minimal self-adjustment. And they have defined these devices much more broadly and applied that definition to a much greater swath of orthotics. That has major implications for competitive bidding if CMS ever moves forward with competitive bidding of off-the-shelf orthotics. So we urge you to contact your member of Congress, go onto our website, and encourage your congressperson to sign on to these letters this week. It's real important that by early to mid-May at the latest, we get these letters sent up to the Department of Health and Human Services. The second letter is a letter addressed to Secretary McDonald of the Veterans Administration, and it's being coordinated by Congresswoman Ellmers, Renee Ellmers out of North Carolina. Congresswoman Ellmers had introduced a bill last year called the Injured and Amputee Veterans Bill of Rights, and she plans on doing so again this year. But before she does that, she wanted to send a bipartisan letter to Secretary McDonald, who's been on the job for less than a year, and appeal to him to make some of these amendments to the VA system of providing prosthetic care and orthotic care to veterans on his own authority. There's no need to pass legislation if we can get the Secretary to implement the key provisions of the Injured and Amputee Veterans Bill of Rights on his own right. And so this letter would do that. We appeal to you to contact your member of Congress, again, through the NAAOP website, and encourage them to sign on to this letter. Congresswoman Ellmers is a real champion for orthotics and prosthetics, and we hope that you will take 5-10 minutes at the most and contact your members of Congress and get them to sign both of these letters. So having said that, I wanted to touch base on the New York State issue. You may know that in New York State, under Affordable Care Act plans sold under the exchange, there is a one limb per life restriction within every private health insurance plan in New York State. And so this doesn't apply to children, but as soon as you turn 18, there is a one limb per life limitation in the benefit. That is a major, major problem, and it's probably the most restrictive prosthetic coverage benefit across the country. And so we've been fighting it with the local and energetic support and leadership of the O&P community in New York, led by Dan Bastian, prosthetist, and John Kemp, his patient, as well as Dave McGill, the president of NAAOP, and a number of New York State and federal advocacy organizations. NAAOP is helping to really coordinate this effort. And in so doing, we've come together and have asked, and have in fact received, letters from both the House and Senate chairmen of the insurance and health committees to the Health Benefits Exchange in New York State, asking them, under their own authority, to change this restriction and to eliminate the restriction in the Essential Health Benefits Package for the 2016 plan year. That decision needs to be made by June 1, so time is of the essence. NAAOP has been coordinating the letters, drafted portions of the letter, ultimately has been working closely with New York State advocates to do all we can to try to get this restriction overturned. We also will be likely filing a challenge with the Office of Civil Rights at the federal level to try to put additional pressure on the state. And in fact, if you go to www.onelimbforlife.com, you can sign a petition supporting the elimination of this restriction. We encourage you to do so. Thanks so much, and we'll see you in a month.